Hi, so my name is Satvik. I'm a management consultant by profession, and what led me to have this surgery was actually a fall in my home itself. Because of slippery floor, I injured my right shoulder and my ribs, and essentially that's what got me here. Essentially anything to do with ortho injuries, Dr. Raghu Nagaraj has always been our go-to person for advice. He is the one who has done consultations for my father for his ortho issues, and he has also been responsible. So when we went to him after getting the primary care at a nearby place, Raghu sir suggested, based on testing and MRI, etc., that I require this arthroscopy surgery on my shoulder to repair my rotator cuff, and he explained the entire process to us visually, told us that why it is required to be done now as an intervention rather than focus on traditional measures or conservative modes of treatment. As a fortunate surprise, we got to know that he is now with Kauvery hospitals in Marathalli. Kauvery is a known brand for me personally, and it came as a pleasant surprise that two of the brands that I trust, one being Dr. Raghu Nagaraj and one being Kauvery Hospital.
Our patient Satvik came to us with a history of injury to the shoulder. So because of slip and fall. So because of that fall, his main muscle of the shoulder, what we call supraspinatus, that got torn completely. So because of which he was not able to lift the shoulder at all. So when there is a complete tear of the supraspinatus, generally they don't heal with the physiotherapy. Only in partial tear cases we put them on physiotherapy, and most of the patients do recover with the physiotherapy. But with the complete tear cases where patient is not able to move their shoulder, in such cases they need what we call as an arthroscopy. It's a minimally invasive surgery where we'll make a small keyhole, and looking in the camera we repair that muscle back. So in a similar way, Satvik underwent this arthroscopic supraspinatus repair. So we put the camera, and looking in the camera we repaired his completely torn muscle back into its position. So once the surgery is done, patient will be discharged very next day. They have to wear a sling for 2 weeks, and after 2 weeks the physiotherapy will be started. With the gradual physiotherapy increasing, the patient will be able to recover slowly, and in a period of 4 to 6 weeks they'll be able to move their shoulder back completely normally, in normal way how they used to do before. Slowly they will be started on strengthening program. As the strength improves with time, which is generally takes 3 to 4 months period after the surgery, they'll be able to go back to their even active lifestyle like playing sports, swimming, playing badminton, cycling, etc. So now Satvik is on his road to recovery, and his physiotherapy is already started.
With the team over here at Kauvery Hospital, everybody has been extremely helpful, extremely thoughtful. The entire process so far has been very smooth. The team is very, very inclined to help you get the best medical outcomes, but also operationally try to make the journey as comfortable as possible. On the day of the surgery, of course, I was anxious since it's my dominant hand, but the team and Dr. Raghu and his team definitely put my mind at ease. They talked me through the whole procedure. Everybody from the support staff to the anesthesiology to the post-recovery team who made sure that they kept my vitals under control. They kept a check on those vitals. The recovery post that in the facility has been very, very well taken care of. The team is on the dot about the medication, they are on the dot about the food, and the focus is to make me as self-reliant as early as possible, and that's something that I appreciate. Nobody gets injured on purpose, but the best outcome that a patient can hope for is that you're back on your feet, of course with the right medical support, but you're back on feet feeling less like a patient every day, every minute, and that's the kind of treatment that I've gotten medically and otherwise. And essentially that will be my suggestion to anybody facing my condition or the challenges that I've faced, that trust the process, trust the professional, and trust the institution. You have got the best of both worlds in terms of hospital care with Kauvery hospitals, and experienced leader of orthopedics and Dr. Raghu Nagaraj. Trust the process and just come. No matter what your anxieties are, the team will do their best to put them at ease. I wish all the best, and I would like to express my gratitude to the entire leadership team at Kauvery Hospital, the operations team over here at Kauvery Hospital Marathalli, Samriddhi, and the entire team of orthopedics, Dr. Raghu and his team, all the support staff, all the sisters, all the brothers at Kauvery Hospitals who've taken so good care of me. Thank you.